Hello, everybody, and welcome to tonight's webinar. Tonight, we are speaking to your celiac care team, and we're looking forward to all the questions that you might have. I'll give everybody a minute to get started. I am going to share my slides here from current slide, and I am actually going to open this up and see if we can get some Q&A going or some chat in the chat box to see, let us know where you're coming from today while we're waiting a minute or so to get everybody settled. So take a minute, get a drink of water, get yourself comfy, and we've got an exciting webinar up ahead. Haley, would you mind on your end ensuring that the chat is enabled so people can say where they're coming from? That would be really great. Oh, I see it over here too. Hosts and panels. I think I can do it as well.
I think I just did.
Okay, awesome. Mine wasn't popping up there. Yeah, you did. Okay, so I see Megan coming from Hamilton. Welcome, Megan. Sherry, North Cowichan, Thunder Bay, Nanaimo. Hey, West Coast represent. Nova Scotia, East Coast represent. Moncton. Lovely to see everybody. Victoria. I'm excited about the BC contingent because I am coming to you from North Vancouver. So we look like we have the coast to coast tonight, which is always what I'm going for. So hi, everybody. My name is Nicole Byram, and I'm a registered dietitian with Celiac Canada. And I'm so happy to be here tonight with Dr. Sarah Shaw and Dr. Dawn Dirksen. I will do their official invites in just a moment. But tonight, we're really excited for this presentation. And I just wanted to say, for the questions at the end, please put that officially in that Q&A box. That's where we actually collect the questions and we actually can keep them. The chat, we're going to keep as kind, respectful conversation, but we won't be actually looking to the chat for the Q&A at the end of the session. So those burning questions, those great questions that are so important for both our physicians here today, we're going to put that in that Q&A, and we will get to those absolutely as we present. And tonight's session is being recorded. So if you have to go, if you get a phone call and you got to go pick up your kid, this is going to be recorded. It's going to be sent to you, so you will get to watch it at your leisure afterwards. Or if you want to watch it twice, you can watch it again to really get all that great information. So without further ado, we will get started. And I want to take just a moment. My land acknowledgement isn't here, so I just want to take a moment to acknowledge the land that I am on. I am on the land of the Musqueam, Squamish, and Tsleil-Waututh Nation, and here I promise to live, learn, and treat this land with respect and dignity that it deserves, and I am grateful to share all of these experiences on this great land. So what is our outline for today? We're going to do some welcome and introductions. We're going to do a quick review of what celiac disease is. If you're here, you probably know somebody. You might have it yourself. You might have a loved one with celiac disease. So we're just going to do that refresher, make sure we're all on the same page. And then we're going to really get into understanding the celiac disease care team. It is so important in this disease, as with most diseases, to have your team of specialists on board that you can ask those really important questions for, to really get your health on the best track and to know where to ask those questions and to where to get those answers from. We'll have a quick panel discussion, and then we'll go right into that important Q&A and get all your questions, and then we'll go over the key takeaways. So I cannot move forward without thanking our generous sponsor, O'Do's, for making tonight's event possible. If you haven't tried O'Do's, absolutely delicious, absolutely wonderful, and we're so happy that they sponsored tonight. So we want tonight to learn how the key healthcare professionals are involved in celiac disease management. We want to learn the role each specialist plays and the importance of that interdisciplinary care, which is so key. And of course, that opportunity to ask questions. So who do we have here tonight? So Dr. Sarah Shaw, who is a family physician out of Toronto, Ontario, and is a member of our Celiac Canada Professional Advisory Council. For the last 15 years, Dr. Shaw has dedicated dedicated herself to family medicine, running a practice in downtown Toronto, and most recently serving on as a chair on the board of directors of Tattle Creek Family Health Team. So welcome tonight or this afternoon if you're coming from BC. Dr. Shaw, thank you so much for being here. And then our Dr. Dirksen, hi Don, nice to see you, is a gastroenterologist and the chair of our Celiac Canada's prestigious professional advisory council, and he is an associate professor of medicine and the acting section head of the gastroenterology department at the University of Manitoba. So we've got two very esteemed professionals on with us to answer all of our questions tonight. So thank you to both of you for being here. So a quick refresher for those of you who want to learn a little bit more about celiac disease. And if, just as a plug for my gluten-free 101s that I teach on the third Wednesday of every month, if you are new to celiac disease, and this is one of your first webinars with us, please do join us at a gluten-free 101, where you will learn everything you need to know from diagnosis to dining out to traveling to label reading. So if you enjoyed tonight's webinar, please come to one of those sessions, and I will be hosting it, and you can ask all kinds of questions there as well. But celiac disease is an autoimmune disease where the immune system reacts against the protein gluten. So as you can see on the left-hand side of your screen, those normal villi, which has lots of surface area for the nutrients to absorb, gets damaged or atrophied in celiac disease, and that causes a malabsorption of a lot of nutrients, which causes both those long and short-term complications of this disease. Those 260 symptoms of celiac disease, which none are unique to celiac disease, making it a challenging disease sometimes to diagnose because it is often seen as many other things. So remembering that this is not a food allergy. Celiac disease is often thought of as an allergy, but it's not. This is an autoimmune disease, and it is a genetically predisposed autoimmune disease. So this means that family members pass it along. So my mother has celiac disease, my daughter has celiac disease, but my husband also has celiac disease, and his sister and his niece. So we are surrounded, and we are a perfect example of that genetic predisposition of celiac disease. Gluten is found in a group of proteins present in barley, rye, regular oats, and wheat, which we lovingly refer to as our brow ingredients. So come to that GF 101 and we can really get into that a little bit more. There is no known cure for celiac disease. So food is our medicine. You have to be on a strict lifelong gluten-free diet once diagnosed with celiac disease. You cannot grow out of it. So this is something we need to really educate, learn about, and support one another in this diagnosis journey and in the journey of living with celiac disease. So now, understanding the role of each healthcare practitioner. So we've got our family physician, and Dr. Shaw is going to speak to this in just a few more slides. But the initial screening, getting the order for that TTG, the tissue transglutaminase blood test, seeing and listening to what are your symptoms, what is happening in your life, what are the barriers to getting to that better quality of life, that better health. And then that might trigger, having those conversations might trigger that need for a TTG blood test, which can then be ordered, and then we will see what those results are and then make the proper steps, take the proper steps from there. And one of those next steps might be going to see Dr. Dirksen, who's a gastroenterologist, who will then go on to do the endoscopy, the villi biopsy, and then providing that gold standard official diagnosis to ensure that that TTG is reliable, and we've got that proper diagnosis. And then once that has happened, you can come and see me or another registered dietitian across Canada to really help you to navigate this journey. So we're in it to win it on this, and we're looking at that nutritional management, looking at really getting that science-based gluten-free diet education. How are we going to troubleshoot your symptoms and really pinpoint what it is in your journey that might be causing cross-contamination if you're having symptoms, or is it something else? And we'll talk about that too. And then of course, ongoing care. So the patient journey for somebody with celiac disease, symptoms begin. And we know that people, and I apologize for the dog crying in the background if you can hear it, she wants out, and I will let her out as soon as Dr. Shaw starts to speak. Symptoms begin. People might start feeling brain fog. They might start feeling dizzy. They might start feeling like they're bloated, gassy, upset tummy. There's a host of symptoms, as I mentioned, 260 symptoms that you might start to bring forward to your doctor and say, this is what I'm experiencing. So then you have that conversation with your doctor, you go to the gastro, consult with a dietitian, then we have that ongoing care. This process is not always linear. Sometimes you consult with the dietitian first and you're like, this is what's happening. And then I connect with your family doctor and say, I think we maybe should run a TTG test on this person. So there's lots of ways that this might not be quite the straight ladder, but we will get there in the end. In our state of celiac survey, which was done recently, I'm just going to move this over. We asked the question, which of the following healthcare professionals did you consult before your diagnosis? And you can see overwhelmingly, family physician was your first go-to. Gastroenterologist, naturopath, allergist, dermatologist. As you can see, they go down. Registered dietitian is unfortunately quite low on that list. So I hope to advocate for that change, but happy to see that family physician and the gastros are your first line, which is exactly as they should be. Okay, so now I am going to, I'll leave it on this screen, but I'm not going to speak first. So Dr. Shaw, I'm going to pass it over to you to let us know a bit more about the role of the family physician in this.
Thanks so much, Nicole. It's so good to be here today. Thank you, everybody, for coming, whether it's the afternoon or the early evening as it is for me. And I really appreciate everything you set up there, Nicole, and seeing that bar graph. I think people really see their family physician as a key player in their health care. And certainly it is the place that often patients start, that they come in, they're having a variety of different symptoms. So a family doctor's role is to help parse out those symptoms and start to think about, okay, what could be the diagnosis here? So to do some blood work, do a referral, if appropriate, to a gastroenterologist like Dr. Dirksen, to do referrals to dietitians, although Dr. Dirksen might do that as well. So certainly to be able to get the ball rolling and communicate to the patient. We've talked a lot at Celiac Canada is the importance of informing patients not to go off gluten before they've started those investigations. That's a really important piece for an accurate diagnosis. So certainly getting the ball rolling would be a number one piece. But as a family doctor who often sees whole families and sees patients over years and years and years, that ongoing follow-up is really key. So you may go back for a health exam every single year. So bringing up the piece about celiac and anything we need to check on in terms of ongoing care, it's that continuity of care. And tests, if you're not feeling better, you might need a referral back. If we need to do more blood work, there's a whole set of the Celiac Association has a wonderful page for family physicians, other healthcare professionals on what you need to be thinking about doing every 1 to 2 years. So I think the ongoing care is number 2 role of a family doctor. Number 3 role I see as having a high index of suspicion for other autoimmune conditions. So if you have a patient who has celiac disease, you really need to be thinking if they're coming in with other symptoms that they could have other autoimmune conditions. And I think the 4th piece is, and dietitians would also play a really important role, so feel free to speak to this as well, Nicole, is I think thinking about the big picture as a family doctor. I really think about the biological, the psychological, and the social. So what's happening for my patient? Are they, for example, are they able to digest the diagnosis of celiac disease? That can be really difficult depending on where somebody is in their own life stage developmentally. For example, you may have a child who's pretty adherent. You can have teenagers who are not necessarily as adherent. That comes with a lot of medical conditions. Or a child who's going off to university, their adherence may change. I've often had patients, when I suggest a diagnosis that maybe we should be looking at a diagnosis of celiac disease and doing investigations, that there can be resistance to that because it means major changes in terms of what they can eat in their lifestyle, and that can mean a loss for them. I also have patients who are just desperate for anything to sort out their symptoms and an answer. So I think about a family physician really provides care across the spectrum. Thanks so much.
Thank you. So I'm just putting my video back on. Thank you so much, Dr. Strauss. So much of that resonated so strongly with my experience and with my daughter's diagnosis and everything. So thank you for sharing that. All right, Dr. Dirksen, we'll pass it over to you.
Sure. So thanks again, Nicole, and I'm happy to be here with Sarah as well. Hoping that we can give some information today that's useful for people. In terms of the gastroenterologist role, I would kind of, excuse me for a second here, I'm just going to I think that I would divide it into several different categories. One of the first roles is to consider the diagnosis when individuals present with a variety of symptoms. Now, as it turns out, a lot of the times and this is becoming increasingly common, it is the family doctors that are seeing the people first, and that first initial screen for celiac disease is done by them. Occasionally, there are unusual presentations, and there's a constellation of symptoms that make me think, hey, this could be celiac, and so we still may order that. So that's one thing that gastroenterologists keep in mind. The second thing, as has been mentioned, and one of the primary roles is really that diagnostic biopsy. And this may be a theme for the evening, but in North America and even in Europe today, in adults, the recommendations from all of the professional groups and societies, including Celiac Canada, would be to get a biopsy to confirm the diagnosis prior to going on a gluten-free diet. And there are a variety of reasons for that, but once you know what the diagnosis is, then it's much easier when that's definitive to deal with things later on as they come. So that's a very important part of the gastroenterologist involvement. Now, a lot of times with celiac disease, the diagnosis is quite straightforward, but not always. And that's the other potential role of the gastroenterologist. There are tough cases where the serology is borderline, the biopsies are borderline, and there are nuances, if you like, and there are lots of nuances. And so while it doesn't happen commonly, it does happen. And I think in those cases, the diagnostic pathway may take longer, and the gastroenterologists are quite involved in that. And then finally, the gastroenterologists are also involved in follow-up to some extent. I think most commonly, if there are ongoing symptoms, in other words, the scenario that people with the gluten are diagnosed definitively, they go on a gluten-free diet, and despite being on the diet, there are ongoing symptoms. And we know from our State of Celiac survey that actually is not uncommon for that to happen. We wish everything would go away, but it doesn't always. And there are many reasons for it. And those include, obviously, gluten exposure. It includes conditions completely unrelated to celiac disease, but maybe occurring simultaneously, or it may include conditions that are related to celiac disease, but not directly to gluten ingestion. So that's another area where gastroenterologists do have some role. So I think in the follow-up role, I see them being involved. And I think that in many areas, who's involved also depends a bit on expertise. So in some places, the dietitian knows the most about celiac, and they have a major role. Others is the family doc, and other times it's the gastroenterologist. If you're lucky, you'll get all three, and that's the best case scenario, because I think that's ideal. Sometimes there is overlap between what all of the three of us do, and I think it's because of the fact that there is some varying expertise around. So I'm going to maybe leave it at that, Nicole, and turn it back to you.
Wonderful. Thank you so much. All right. So the role of the dietitian. So this is something I've actually put a few slides together just because that's how my brain works. So the role of the dietitian in celiac disease. So, we're really grateful to be working as an interdisciplinary team, because I think as Dr. Dirksen just said, that brings the most to the table. But from my perspective, education on the gluten-free diet, that is the starting place. So how do you read a label practically when you go home and you look in your cupboards? How do you know what to eat? I know from when my daughter was diagnosed, it's different. When your child is diagnosed, for me, the experience was quite stressful. Despite being a dietitian, I still was very stressed about it and very worried. And I still went home and I looked in the cupboards and I thought, what can I feed her? So I can appreciate being in the shoes of people who have just been diagnosed, because it can feel very overwhelming. And so it's my role to really help ease that stress and ease that anxiety by using education as a tool to better understand what's safe for you and what isn't. So we go through label reading, the laws that, we're so lucky here in Canada with Health Canada and with the Canadian Food Inspection Agency, ensuring our safe labeling and safe the regulations to ensure that the brown ingredients are not in products that don't say they're not there. So we go through all that. We make sure that you've got all the education that you need. I also talk a lot about nutrition assessment and risk management. So we talk about what deficiencies did you go into this disease with? What do we need to follow up with? What do we need to talk to your family doctor about testing for again? Do we need any supplements on board that we need to have those conversations about? And we monitor growth in children. Are they growing now? What's the trend line doing? So we're looking at all of those things. We're talking about cross-contamination. If you're going to friends' houses, if you're going to a restaurant, if you're traveling, how do you prevent cross-contamination in these settings? So this is another really big part of that conversation. And then that symptom management and troubleshooting. So as Dr. Dirksen would say, although we wish that when somebody was diagnosed, they went on the gluten-free diet, they'd suddenly feel better and everything would be wonderful. But in a perfect world, that black and white just doesn't exist, and there's a lot of gray. And so sometimes we need to really troubleshoot. Is there something that's being cross-contaminated in a shared kitchen? Are you eating out on a regular basis? Is there something that you think is gluten-free, but maybe there's an ingredient in there that you didn't notice? So we really talk about that. Or is this an IBS in conjunction with the celiac disease? Is there something else going on? So we talk about all those different things as well. And of course, then that long-term monitoring and collaboration with that healthcare team. So monitoring that TTG level on an annual basis, seeing what it's doing, seeing the growth trajectory of your child, asking all of those really important questions. So that is the role of the dietitian, in overlap quite often with some of the other disciplines, but that's what we do. So just that important role. And then there's lots of common challenges in the diagnosis and management of care. So we'll open that up now to that Q&A for everybody and see what we have here. So I'm actually going to stop sharing my screen so I can get the Q&A into a bit of a bigger box for my eyes to read. Okay, so Lourdes asks, processed gluten-free food, why not labeled? Okay, so I'm going to assume this is a question for me. So Lourdes, I encourage you to come to one of the gluten-free 101s because we really go over that those labeling laws. If things are labeled gluten-free, yes, they are gluten-free no matter what, but not everything is going to have gone through the testing to carry that gluten-free label. But there is lots of foods that you can still eat even if they're not labeled gluten-free. So you're looking for those brown ingredients in a ingredients list, and it contains and in a may contains. But again, please do come to that next third Wednesday in April. So not next week, but the week after. Kaylee, if you could pop that date in the chat, maybe a link to the sign up, that would be amazing.
Yes, I did. It's April 16th, next Wednesday.
Thank you. Okay, Anonymous says, is low potassium, even a decade post-diagnosis, common in folks with celiac disease? So I'll pass that on to one of maybe Dr. Shaw.
Thank you. To be honest, I haven't seen that in my patients with celiac disease. I wouldn't imagine that 10 years post, but I do often see potassium changes with other medications. That's the most common place I see potassium imbalances is due to other medications, or if there's some acute illness, which is not the case here.
Yeah, okay. Super. Okay, and then Hardeep asks, is it necessary to get retested? I was diagnosed in April of 2014. Do either of you want to tackle that one?
Sure, I can go with that. I think it depends a bit what you mean by retesting. So we do recommend, and again, these recommendations do vary a bit from group to group, but in general, we recommend repeating the TTG antibodies because they're obviously easy to do. And just my caution with those is that they're not perfect. So there are people that have a normal TTG and may still have some gluten exposure and some intestinal injury. and there may be people who have a higher TTG, and their biopsies actually look very good. So there are, well, we recommend doing it. There are exceptions to them because they're not perfect. The other question would be, should everybody have a routine biopsy as a follow-up? And that's a bit more controversial. Our practice has generally been not to do that in everybody. So if your diagnosis is very clear and you've been very good with a gluten-free diet and your symptoms have improved and your TTGs have normalized, then for most folks, we'd say, you know what, that probably is enough, that you don't need to have a rebiopsy done. So I think that would sort of be the standard right now. And then if some of those factors haven't been met, then a biopsy can be considered. One thing to, again, I would just emphasize, which we know, is that it takes quite a while. It's interesting, people's symptoms get better quite quickly when they go gluten-free. It's amazing. Sometimes after a couple of weeks, they feel so much better. Their antibodies take a while to come down. That can take 6 months to a year. And the biopsies take even longer. So sometimes for the biopsies to normalize, this may take a couple of years and even longer. So we're in no rush to follow up with biopsies, but it is something that might be considered on a case-by-case basis.
And that's a really common question that people ask. How soon will I start feeling better? How soon will my TTG normalize? And how soon will I start absorbing things? Those are 3 questions I get on a regular basis. So thank you for pointing that out. Erin asks, can you speak a bit about the research into medications or cures, please? The gluten-free diet is fine, but it would be great to be able to participate in meals more spontaneously, especially for children, teens, and young adults. Erin, I think that question is on the tip of many people's tongues. So again, open it to either whoever wants to take that one, maybe Dr. Dirksen.
Sure, I could go after that one as well if you like. No, I think that has been, as Nicole rightly said, at this stage, there isn't anything. Okay, so as of April the 7th, 2025, there is no medication we can recommend. We wish there was, but there isn't. Having said that, there are clinical trials, meaning there are trials where they're testing different medications to see the role that they might have. And because we understand the different pathways of how ingesting gluten ultimately leads to this injury, and there's many different steps along the way, there are potential ways to intervene at these different steps. And what's being looked at right now, for instance, is a very potent enzyme that you would take with your food. And that enzyme can chop up the protein, and it's a 33 amino acid protein that causes the damage. And so if you happen to have some gluten in your diet and it mixed with this enzyme, it would break it down, hopefully before you got to the intestine, and that would be effective. And they're testing to see whether that's effective. So that's one that is well on its way into what we call phase 3 trials. So these are large trials that are looking at effectiveness and looking at biopsies to see if it works. There's a second one, a mechanism where the TTG antibody has a role in actually processing gluten so that the immune response is magnified, and there are inhibitors of that to see what that does. And then we know that HLA-DQ2 and DQ8 are important in people with celiac disease, and that's also important in how gluten gets presented to cells, and they're blockers of that receptor that are being looked at. And then finally, there are some immune modulators that once the immune system is activated, there's a bunch of proteins that are released that cause damage, and to try and inhibit those proteins is a fourth way. And then the fifth thing, which is probably the most exciting, but also it's sort of the home run, would be like a vaccine, where if you could give people small amounts of gluten in a certain way, could they actually develop tolerance so that ultimately they wouldn't have to do this? And there is such a thing out there that is being tested by Takeda, one of the companies. And so, just the fact that it's being tested is very positive. I think that there's obviously a lot of things have to go right in order for this to work, but it's exciting that at least it's being looked at. And then what I would say, Nicole, just as an overall message, I'm sort of cautiously optimistic about medications. However, none of these promise, other than the vaccine, to actually do away with the gluten-free diet. I think all of them are looking really at maintaining a gluten-free diet. Those people where there might be gluten getting in, somehow contaminating the diet, when travel, when at the workplace, et cetera, it would give people something that they could use as an adjunct to gluten-free diet. But gluten-free diets are still pretty much here to stay and they're still the fundamental treatment part of the celiac disease.
So for example, if somebody was on holidays, they had a glutening, got sick, the medication could be something they could take to help ease the symptoms at the time?
I think that's a different thing.
Okay.
That's a different thing. This is more, you're going on holidays. You think you're going to be exposed because the restaurants you're not sure about. So you go into a restaurant and you take this with your meal.
Gotcha. You take it prior to.
Yeah.
Okay.
Yeah.
Exciting. Exciting.
Now, you brought up the post-symptom treatment. We don't have too much. When I was last at a meeting in Quebec City, and I spoke with some celiac people who do celiac research in the States, they were mentioning that there is some evidence now for the first time that perhaps taking budesonide, which is a certain type of steroid, and taking it immediately after ingesting gluten might have some benefit, and that remains to be seen. So that's something being studied. So that's also a research thing that people.
I think all of that is very exciting to our community, and I certainly know that when my daughter gets gluten, her symptoms are through the roof. She missed a whole day in Disney World last year that she would have loved to have that for. Fingers crossed one day, everybody. Okay, anonymous attendee asks, what besides celiac disease can cause, and this is again a very common question, can cause the TTG to remain high and or rise substantially in the absence of symptoms despite following a strict gluten-free diet? Would a biopsy without a gluten challenge be informative in this type of situation? Dr. Shaw, do you want to speak to that?
To be honest, I think that's better from Dr. Dirksen when we're talking about biopsies, but thank you.
I do see that one quite a bit as well. So, I wish I had a better answer for that. There are some GI conditions. For instance, people that have Crohn's disease and colitis have a higher chance of having a positive TTG. So we do think about some other GI diseases. I would say most of the time that the scenario I see where people have a prolonged elevated TTG, but they're very adherent to gluten-free diet. In fact, their biopsies are normal. We don't find the cause, quite frankly, that it's another. We think there's some immune activation, but we're not quite sure what it is that's doing it. So unfortunately, we don't really know. I think in that case, it's really important to get the biopsy to know what's happening.
To get the follow-up biopsy in a case like that.
Exactly.
Okay, thank you. Sherry asks, for children 9 years, is an endoscopy/biopsy always necessary if the blood test came back clearly positive and the child has been confirmed also as anemic? So this is speaking to that non-biopsy approach to the pediatric population. So who would like to take that one?
Sarah, do you want to go for that one, or?
Sure. I mean, I guess I would think specifically about some of the European guidelines for kids in terms of celiac diagnosis, but I think the first choice would be, let's really try and get a biopsy so we know. And I say that for a couple of reasons, because once you stop eating gluten and you feel better, the idea of going back on gluten and going through a challenge, I think it's a very big ask for individuals and their families. You can feel really sick. If you suddenly feel well again, the idea of going back on gluten just does not seem acceptable. So much better to do this all at the beginning. And typically, if you're looking at the European guidelines, it wouldn't just be based on a TTG and anemia. It would actually, you'd have to do some other testing. So that wouldn't even fulfill the European criteria, unfortunately.
And yeah, I totally agree with what Sarah says, and I think that what I'd even say that it'd be worth getting an opinion from a pediatric gastroenterologist, so for exactly that reason, to see whether it's worth going down that pathway or not.
Okay, super. Again, that's a question we get quite a bit. Okay, Mariette asks, if my diet is perfectly gluten-free, is the condition itself causing symptoms on its own? So does celiac disease in the absence of gluten just feel crummy sometimes? Do you want me to speak to that?
Yeah, I mean, I'll also say one thing.
Yeah.
Take it over. I mean, I think that, again, it depends where we're at here in the recovery process. I think that if people are on a gluten-free diet, they have been on it for a period of time, they're very good at it. And let's say, for argument's sake, their TTG is normal, and we think they're doing very well. in that case, I think their symptoms are probably not related to celiac. If they're having, say, GI symptoms or some other symptoms like fatigue or joint symptoms, I would be looking for some other things.
Yeah. Dr. Shaw, did you have anything you wanted to say about that?
No, that's great. Go ahead, Nicole.
I think as a dietitian, I'd want to do a little sleuthing into what other things could be triggering similar symptoms in the diet. So is there lactose intolerance? Are they eating a lot of oats that could be causing symptoms but not raising the TTG? So some people, about 20% of the people with celiac disease, respond to a protein in oats in a similar fashion that you would experience with your celiac symptoms, but it's not celiac disease. It's again, as Dr. Darcher said, something else. So I would want to go through a little bit of an elimination diet with you to figure out if there's something else that could be contributing to those symptoms, and figure that in a really strategic fashion. So yeah, hopefully, Olivia, that answers. Oh no, that was somebody else before. That answers your question. All right, Olivia asks, what other autoimmune conditions are common for individuals with celiac disease?
I mean, the thing that I think about on a regular basis is thyroid dysfunction. So it's something that I would regularly test for. I also would have, an index of suspicion for inflammatory bowel disease, so Crohn's, ulcerative colitis. I think about, and I'd really be thinking about any joint concerns, so rheumatoid arthritis, those kind of things.
Yeah, great.
Right.
Yeah, no, I think, oh, sorry, Dawn, you were muted there.
I was just going to completely agree with what Sarah said.
Yeah, perfect. Okay. Okay, next question. Kuljinder asks, I have a related cross-contamination question. How badly does cross-contamination affect the body with celiac disease? Let's say it's wheat that's harvested on a farm and the air is blowing out from the side. Will it be considered that I'm inhaling gluten? So, I can quite simply speak to this, that, ear, nose, and throat are all connected. So if you're breathing in gluten in the air, and you swallow, it's coating your throat, is getting into your digestive system. So anytime that gluten can access your digestive system, we're running a risk of it. You can handle it, you can touch it, you can be around it. But if you breathe it in or it gets in your mouth because it's been on your hands and then you touch your mouth, that is a form of cross-contamination. And cross-contamination, as we know, over time can cause that TTG to be high, can cause villus atrophy, and can cause those both long and short-term complications. So we really want to figure out and target in what we can do to reduce that and eliminate it overall from your diet to really help you on the long term. And I think I actually missed one up top. Yeah, my symptom started with, and I'm not sure what this is, urticaria, and has been over 3 weeks. I'm on a strict gluten-free diet. My skin rash and digestive issues are still there. Is this normal?
Yeah, I can say a few things about that. Urticaria is not a typical skin manifestation of celiac disease. Dermatitis herpetiformis, which is more of a blistery skin rash, is quite typical and quite associated. If there was urticaria, I would worry that there was something else that was causing the urticaria, whether it was some type of contact thing or related to a soap or related to some other allergy of some sort or some other medication. It would make me think of something else, to be honest with you.
Okay. So best to go see your physician, your family physician, or a gastro. Okay, we've got lots of questions, so I want to make sure I'm asking the really targeted ones. Somebody's asking about the ongoing management of TTG. How often should we redo the test? And I'll speak to it, and please, if there's updated stuff, let me know. But we would want to test that TTG every 6 months until it's normalized, and then annually thereafter to make sure you're on track. Okay, excellent. All right, next question. Do the specialists encourage additional blood work or genetic testing for siblings once the child is 3 years old or older? Excuse me.
Yeah, I can answer that from my point of view, and Sarah, you can answer from your point of view, because I don't know if we're different or the same. We can see. I would say that if someone's been diagnosed with celiac disease, first-degree relatives have about a 10-fold increased risk, and so I do recommend testing siblings and or parents at baseline, to see if they have it. It becomes a bit trickier how often you should do it, because it is possible for people to be negative initially and then become positive later on. Usually my answer is that if they're negative initially, then my threshold to repeat is very low if symptoms recur. I don't necessarily recommend a routine to do it regularly. But I have a very low threshold that if there are symptoms that are even quite subtle, that it's worth looking for it. So that would be my general approach to family history. I think it's a reasonable indication to check for it. And it is a bit controversial how often to do it.
Mm-hmm. Mm-hmm.
I don't know, Sarah, what your practice is, but
I agree completely. I have a low threshold to test, and when I have a patient with a new diagnosis, I actually tell them to have a conversation with family members. I think it's really important. And because we know that celiac disease can present in so many different ways, from people who come in and are very symptomatic to people who have silent celiac disease, I actually think it's really important, even within the same family. I have celiac disease. 2 of my 4 boys have celiac disease. They both present it completely differently. One, like, always a tall kid, the biggest in his class, said he had no symptoms. His antibody, his TTG levels were the same, off the charts, as his older brother, who suddenly fell off the growth curve, but never complained of a stomach ache until we tested him. And then he said, well, I thought that was normal. So it can really present in a range of ways. I think we have to do the investigations. And I actually think, as a family doctor, I see it as an important part of my job to inform family members that I'm thinking about the whole family.
Yeah. Yeah, no, absolutely. Okay, next question. Can you explain the Marsh levels? Marsh score. My son was just diagnosed with a Marsh score of 3. What does this mean?
sure. There's been a way. Marsh has been a categorization that is a bit standardized, so it's helpful when you are a physician or to know just what that means. And Marsh 0 means it's normal. Marsh 1 means that there's a few lymphocytes in the villi, but they're not injured. So people would consider Marsh 0 normal. They'd also consider Marsh 1 not diagnostic of celiac disease. So it's not totally normal, but it doesn't mean you have celiac. There's lots of other things that can do it. And then Marsh 2 is where there are villi those are the fingers, and there are crypts below the fingers. Marsh 2 is where the crypts are sort of elongated, which we don't see that very often in isolation, but really 3 is where there's some villus injury. And there's a 3A where there's some blunting, so there's some loss of villi. There's the 3B where there's been quite a bit of destruction, but not totally flat. And then there's C where you've kind of lost them completely. So there are 3A, B, and C. And certainly 3A, B, and C are all consistent with celiac disease. So if you had a positive antibody and had Marsh 2, 3A, 3B, or 3C, we would say you definitely have celiac.
Okay,
Quick
great.
thing. Yeah.
Thank you for that. Stephen asks, is anyone using a GI camera pill to explore the cilia here in Canada?
Again, I can take that quickly. It's kind of a GI question.
Yeah.
I would say that the pill cameras are actually part of some of the studies that are being done with drugs to look at parts of the intestine that are lower down. It hasn't become a routine tool to look at celiac disease, that the biopsy seems more important. There definitely are changes that the pill can see when it's done. I don't think anybody thinks that it's better than a biopsy, even though it's less invasive. You're just swallowing a camera. So I'm not sure where that's going to go, but it might be helpful in people who don't respond to a gluten-free diet. We don't know yet about that. Right now, I think that because the biopsy is so important and the pill doesn't do that, it has a limitation in that point of view. So the answer is, it's a technology that definitely there's more and more experience with what things look like in celiac, and there definitely are abnormalities that we can see. And occasionally it happens that people weren't thinking celiac and they have a capsule for a variety of reasons, and the person reporting it will say, think about celiac because I see X, Y, and Z. That does happen on occasion too, but it doesn't have a central role at the present time in terms of the diagnosis.
Okay. Dr. Shaw, we'll ask you this. Is dry mouth related to celiac disease? And if so, how long would it be till I see improvements after going gluten-free?
I don't see dry mouth in and of itself as being related to celiac disease unless you have another autoimmune disease that can give you dry mouth, dry eyes, like dry mucous membranes. In and of itself, I have never seen that with celiac. I mean, please speak up, Dawn, if you're seeing that. I would think about something else. Medications are often a cause of dry mouth, being dehydrated. Those would be the two top pieces. And of course, there could be a dental issue, but typically it's medication and maybe a low level of dehydration.
Okay, great. That one, I do hear that quite often as well.
Oh,
Yeah, okay. Thomas asks, if you get glutened a few times a month and kill the villi, will it turn to cancer? People say it will. So that's a scary thought. So why don't we speak to that, and whichever one of you feels you want to take that one.
I can start with it. I think that first of all, there is quite a bit of varying sensitivity between one individual and another that we know happens, and we're not quite sure why that is. I think in general, people feel, and the second thing I'd like to point out, which is a fact of life, and we've done some studies that have proven this, even when you're gluten-free and when you know what you're doing and you're good at what you do, gluten creeps in. And it may not be your fault, but it's because of contamination and various other things. So it does happen inadvertently many, many times. And I think if it's a sporadic occurrence, in other words, happens rarely, we don't think that I sometimes will see people in clinic and they had an exposure inadvertently, and sometimes it's quite a big one because they had a pizza inadvertently and they had bad symptoms, and we check their TTG and there's nothing. Like you see nothing. We don't tend to biopsy those people, so I don't really know what's happened to the villi. My sense is, and I think this is the sense of most people, that to get villus injury, it really takes more repetitive, ongoing, regular exposure. So that if you have sporadic exposures periodically, it affects your symptoms, which isn't good. But from an injury point of view and from a cancer risk point of view, I think there's a minimal effect, to be honest with you. I think it's very, very unlikely. And I think the whole cancer issue, cancer is rare. It is increased in celiac disease, but it's rare. And it is much more common when people aren't adherent to the diet, but that means you're eating a fair bit of gluten. So a periodic exposure, I think that a cancer risk would be not affected at all. I'd be pretty comfortable in saying that. But I think so. I think that the occasional exposure, which is almost unavoidable, although it causes symptoms, and I wish we had medication that would help with that. I'm not too worried about it from a cancer point of view.
That's so reassuring to hear. I know for so many people in our community, because I always share, on average, I would say my husband and my daughter get gluten probably twice a year.
Right.
And I share, I'm a dietitian with Celiac Canada, and it happens to my kids. So despite best efforts and intentions, it's going to happen in the community in some form or another, but I'm never worried that it's going to cause those long-term complications when it happens. So that's so reassuring to hear, Dr. Dirksen, for our community. So thank you for that. I will speak to Linda's question here just quickly. Is celiac testing still being covered in Ontario? And the answer to that is yes. The TTG, the initial, now correct me if I'm wrong, Dr. Shaw, but that initial TTG is being covered, but not the annual follow-ups. Is that still correct?
That's how I understand it, but I don't think my patients are always getting charged at the time. I don't always ask them, but when I do TTGs, it used to be that there was a big fee, and it was truly was a barrier. I think sometimes even if it's on follow-up testing, it's not being charged. Now, probably the lab should charge it, but I find that they're not always charged.
Okay, that's really interesting to know. Okay, now this is an interesting question, and this is plays out I see in real life all the time. So this is from an anonymous attendee. After years of symptoms, the blood test recently showed now this is interesting as well, the way that it's written. The blood test recently showed a high risk of celiac disease. So I wonder if they've had genetic testing, but since then I've gone gluten-free. I'm not interested in returning on gluten to get the endoscopy. So what we're seeing here is somebody who has gone on a gluten-free diet, and I'm going to make a few assumptions into this, anonymous attendee. So apologies if I get anything in your situation wrong, but somebody's feeling unwell. They suspect it's gluten that's causing it. They've gone gluten-free without getting an official diagnosis. What do we think about this?
Yeah, I would say that, again, there really are two conditions that could be doing this. This could be celiac disease. This could be something non-celiac gluten sensitivity, where there isn't damage going on to the intestine, but there is a sensitivity to gluten. And so to distinguish those, that's where you really need the blood test and the biopsy to know which is which. And so I would sort of advocate it's best to get tested before you're gluten-free. Again, just as for those people that are interested in sort of cutting edge stuff, there is research going on where there seems to be a protein called interleukin-2 that when you are exposed to gluten, it goes up within 30 seconds, within 30 minutes of exposure. So in Australia, there is some work being done where you have one hit of gluten, so 3 or 4 grams that you ingest, then you get a blood test. And if that interleukin were to go up, you would say, that is diagnostic of celiac disease. We don't quite have that yet, Nicole. And that
you see my excitement.
There are studies being done on which would make life simpler. Otherwise, you're going on a gluten-free diet for 6 to 8 weeks, a gluten-containing diet for 6 to 8 weeks, having to subject yourself to eating this gluten. And the only other thing I'll emphasize, which is important, is that the type of symptoms and the severity of symptoms don't predict celiac disease. So just because they're severe doesn't mean you have celiac. That still could be non-celiac gluten sensitivity. People can be really sick with this and not have celiac. So I think it can be helpful to make the distinction.
Great points. And I've been following those, the interleukin-2 studies to see, because boy, would that make life so much easier. Because one of the barriers to diagnosis is that darn gluten challenge for people who have gone on a gluten-free diet. And so, gosh, would that ever be fantastic for so many people? And I think we'd see our diagnosis rates go up, because I'm sure we're not capturing everybody who has it because people are going on the gluten-free diet before diagnosis. So really exciting. So I'm going to Australia this August. So I wonder where that study is being done. All right, Dr. Dirksen, an anonymous attendee asks, is an endoscopy necessary and or typical in the diagnosis for kids, especially with a high TTG score and significant EMA?
Yeah, I think that, and Sarah touched on this before, that the European groups, their official societies have said, if you're pediatric and your TTG is more than 10 times the upper limit of normal, and your EMA is positive, and your HLA DQ2 or DQ8 positive, you could make the diagnosis. You have a super high chance of having celiac. And so in Europe, they will accept that without a biopsy as a diagnosis. Here in North America, there's been some adoption of that, but I think I would, again, recommend that people still be referred to pediatric gastroenterologists that could talk about the pros and cons of that approach.
Okay, super. Thank you. Now, there was a question here, and it's a question I've heard a lot from the community as well. And this person's worded it as, why is celiac disease increasing? But I'm going to change that to say, is celiac disease rates increasing or incident rates increasing? Or are they, I should say?
Yeah, so they are. And the study I quote, and I talk to med students about this too, is the really interesting study in the States from Mayo Clinic, where they had blood from Army vets from back in the early 1950s, and that blood was stored, and then they had Army vets currently that are in the Army currently, and they had age-matched controls. So they looked at the blood from the 1950s and the blood from now, and the people now, when you matched everybody up, it was 4 times more likely to be positive on a blood test now than it was in the 1950s, which tells us that's some evidence that, yes, it's not just that we're better at looking for it because we know the symptoms, et cetera, et cetera. No, it actually seems to be getting more common. So I think that, and there's a couple of other studies along that line that suggest that this is not just a matter of us recognizing it better and testing better. It is becoming more common.
And we don't have a why to
And we don't have a why. I think
we
the
don't have
simple
the why.
answer, the simple thing that people say is we have so much more gluten that people are exposed to more gluten now.
Yes.
And is that in some way driving that increase in some
And so the question I then would ask, in countries that had low gluten ingestion, once they're adopting a more gluten-containing diet, are we seeing increased rates of diagnosis in those countries?
Yeah, good question.
Do we know? Yeah.
Don't really know that. I think
Yeah.
people were, the other thing that's been a bit controversial is that people are wondering about whether the time of gluten introduction was influencing that. So there's been lots of people say you should do it early, lots of people say you should do it late.
Yes.
And there's been epidemiologic studies from Sweden, that suggest that maybe their increased rate was related to this. And I think that some of the studies now have sort of interestingly shown what we have commonly done pragmatically, and that's introduce gluten at around age 4 to 6 months. When you're introducing solids, is a good time to introduce gluten, as opposed to waiting longer. That could be more harmful. But we don't think that's been the big driver of why it's becoming more common, to be honest.
Yeah, I certainly did all that research when I had my third, after knowing that my second had celiac. And that's what I discovered exactly. Veerpal asks a quick question here. Walnuts that may contain statement, are they safe to consume? So everybody, if it says may contain barley, rye, regular oats, or wheat, it is a no-go, unfortunately, for our community. We are not to have any foods that have any of those brown ingredients in the contain statement, and may contains or in our ingredients list. So good question, Veerpal. But if there's no brown ingredients in any of those three, then those walnuts would be safe. Okay, next question. I think we probably have time for, I'm going to say 2 more questions, everybody. So I'm going to try to be strategic here if I can. Kaylee, I can see, is answering a couple of these questions. Sorry, everybody. I want to. Oh, this is interesting. One person in our family has celiac disease and our kitchen is gluten-free. For the non-celiac family members, does eating mostly gluten-free food sensitize them to developing celiac disease?
I wouldn't think so. So I think the only thing there, which again is kind of interesting, is that let's say they were someone who was destined to get celiac disease just because there was a family history and they were going to get it. But now that they're not eating much gluten, that diagnosis may be difficult to make because they're just not exposed to it much. And so, because they've essentially adopted a gluten-free diet, but it shouldn't affect their risk one way or another.
Okay. And I'm going to use this one as our final question because I often hear people come to me and say, but I had this procedure done and nobody told me, they said it wasn't celiac disease. Colonoscopies. This person says, I'm going for a colonoscopy. Will they automatically test for celiac disease?
That's a good question. I get asked that too. So when people, when we do biopsies, they're done from the duodenum, which is just beyond the stomach. And that's because the duodenum is where gluten is first exposed. And by the time gluten gets through the intestine, it's been digested up. So by the time it gets to the colon, there's no more gluten left. So the colon doesn't get affected at all. So you cannot make the diagnosis on colonoscopy. There's no way of doing that. There is a condition related to celiac disease called microscopic colitis, where it causes diarrhea, and it's related to celiac. And people that have celiac have a higher chance of getting it. So if you're careful with a gluten-free diet and you have diarrhea, sometimes we'll do a colonoscopy to look for that, but that doesn't respond to gluten-free diet. That responds to certain medication, and that's a different problem. So no, you cannot make the diagnosis of celiac disease via colonoscopy.
Wonderful. Thank you for that.
Nicole, I'm sorry.
Yes.
I can't, for some reason I can hear Dawn, but I can't hear you. I don't know if anybody else is experiencing
Oh, thank you.
that.
Kaylee, can you hear me okay?
Yeah, I can hear you.
It's just on
But
my
some
end.
people are saying, no, it's not. Some people are saying they can't hear me and some are saying they can. Huh.
I
Isn't
can
that
hear you. I
the
think
wonders of Zoom? Well, we're wrapping up.
Yeah.
So, so
Okay,
Kaylee,
I think
can
it's just
everybody hear
me.
you?
Nicole, if
Okay.
you have a question for me, I'm going to ask Dawn or Kaylee to speak up. Thank you.
Kaylee, can I ask you to just say something and see if Dr. Shaw can hear you?
Yeah, I don't think she can.
Okay. Okay, because I was going to ask Kaylee to do the wrap up then. So in case it's happening with anybody else, but because some people are saying they can't hear me. I'll wrap it up anyway. So 5 o'clock almost here, 1 minute away. So thank you so much to our incredible panel for being here this afternoon, this evening, for sharing their knowledge and sharing all that they know about supporting all the questions. Really appreciate it. We're so lucky to have our professional advisory council and all the information sharing that we have there. So appreciate that. Thank you everybody for joining us tonight. Lots of other exciting events happening within the celiac community. Don't forget that next month, May, is Celiac Awareness Month. So wear your green ribbons, get out and support. And then please do join me every month. I'm hosting those gluten-free 101s. If you have more questions for myself, please come. I saw a few for me. So please do come to that gluten-free 101. If you have further questions for Celiac Canada, info@celiaccanada.ca, and of course our website celiac.ca, where you can find all of your information about celiac disease, knowing that us as a community are here to support you and to help guide you through this journey. So thank you so much everybody for joining us tonight, and I hope everybody has a wonderful rest of your evening. Thanks so much everybody.